All right, joining me now to talk about all things COVID, we have emergency medicine Dr. Christopher Colbert. Thanks for joining us. It's always a pleasure to have you, doctor. So at this point, right, we're hearing that Pfizer is working on a Omicron specific vaccine. Isn't it kind of pointless by the time it's released? I mean, the next variant, which is now already out, we're talking about a subvariant of Omicron. Do you think it's worth even putting more time into this?
So there's worth time investing in preparing for anything that can come down the pipe in reference to tools to decrease the spread and the burden of disease. So in the context of scientists and education and data that is used to identify any tools, it's always important. It's still a different step for if something else happens in the immediate future or another variant presents. We have something and an effort in working on something in addition to what we already have.
All right, well, speaking of that, I kind of briefly asked you in the first question, this new subvariant of Omicron, right? 96 cases have been reported in the U.S. so far. Tell us what you know about this so far.
So at this point, we just know it's 96 variants that are having a somewhat of effect that they're identifying right now.
Wait, you said variants. You mean cases, doctor, right?
Cases, excuse me. Thank you. Cases that are identified right now. There's so much data that we need to collect before we draw a line in the sand and start committing to what exactly we're finding. And so again, I always communicate, even when this was a conversation of Delta and Omicron, for us to be patient and wait for the peer-reviewed and the data that is assessed. Prior to this conversation, there was a politician making comments in reference to monoclonal antibodies, clearly without complete information. It's so important as we move forward, as we've tried to do in the last 2 years, is to pace ourselves in our delivery of information and to provide that information so that it's complete and it's productive moving forward.
Yeah, Dr. Colbert, you almost scared me. I was about to run for the hills. I'm like, 96 variants? Come on. I mean, when is this thing going to end?
My apologies. Thank you for that correction. That's extremely important.
No, it's all good. We got you. We got you here at BNC Live. So let's go to the World Health Organization, right? They're saying 3 billion people are still unvaccinated. Talk about the effect that that's having on all of us, right? I mean, that's ultimately how Omicron came about.
By definition, the vaccination works. And those individuals who receive the vaccine, it significantly mitigates the symptoms. And that, in essence, is the challenge that we're having. It's not just a problem with COVID in and of itself. The challenge that we have is the burden of disease. And I think it's extremely important to define that. So the burden of disease are admits to the hospital, individuals calling off of work at airports and different means of people to travel. There is a ripple effect to those individuals who choose not to receive the vaccination. It's not just you getting sick. It's beds available in the hospitals. It's having resources and schools open and decreasing the spread of these viruses with individuals who are susceptible. So it's extremely important for individuals as we move forward to receive the vaccine because it works, and the burden of disease will significantly be lessened as more people receive the vaccine.
All right, so let's talk about being a good global partner, right? The Biden administration announced today that they've shared 400 million doses of vaccine around the world. Pakistan receiving 47.5 million of that dose. Now, Dems are also urging the administration to do more in terms of this global vaccination effort. If everyone was vaccinated, Dr. Colbert, would we eradicate this virus?
So we would not eradicate the virus. What we would do is significantly put a pause on the burden of this disease. Again, if you look outside of the United States, other countries, Australia, England perhaps, those are countries in which the vaccination numbers are significantly high. Specifically in Australia, it's higher than 90%. And if you look at the burden of disease on their hospitals, the burden of disease on their workforce, it's nothing compared to what we have in the United States. So when you look at other countries, we encourage other countries to receive the vaccine. We can look at ourselves as well. So there is a huge effect globally if we encourage other countries and support other countries in receiving the vaccine and having access to the vaccine.
Yeah, Dr. Colbert, one thing I noticed that all those countries you named are wealthy ones. which goes to, the whole other subject of the inequity when it comes to vaccine access. But that's a whole topic for another day. Dr. Colbert, always a pleasure. Thanks for stopping by, sir. All right, when BNC Live returns, more on the big news from the High Court. Supreme Court Justice Stephen Breyer reportedly ready to step down. What did